Namaste, I am Dr. Chaitra Gowda, Consultant Obstetrician Gynecologist at Cloudnine Hospital, Bellandur. Menopause is a natural biological process which marks the end of your menstrual cycles, that is menstruation. In India, the average age of menopause is between 47 to 52 years of age, and most of the women start experiencing the premenopausal or perimenopausal symptoms 5 years before these attaining menopause. So what are the perimenopausal symptoms? Usually it starts with menstrual irregularity, and the menstrual irregularity, either it can cause heavy bleeds for a prolonged duration, or it can cause hypomenorrhea, that is reduced amount of flow, or sometimes, very rarely, menopause occurs abruptly, that is sudden loss of menstruation will be there. Other associated symptoms will be like hot flashes. Women will experience severe sweating, hot flashes, like every hour it might come, and loss of libido, that is sexual drive, will not be there, mood changes will be there, loss of sleep will be there, exercise capacity will be less, and the chances of weight gain will be more. See, as the menopause occurs, the body metabolic rate comes down. So even if the woman is having the same amount of diet, she will have to exercise more to maintain the same weight. And also the risk for cardiovascular diseases will increase. See, estrogen, which is there in before reproductive age, it helps in maintaining our cardiovascular health, and once the estrogen decreases in menopause, they are more prone for heart attacks and strokes also. The next important one is osteoporosis. Once the estrogen deficiency sets in, bone starts becoming weak and brittle because of the decrease in calcium deposition. Also, there can be urinary incontinence in menopausal age or perimenopausal time. Why this urinary incontinence occurs? Because of the loss of estrogen, the urinary tract tissues loses elasticity, and contraction of the muscles around the urethra will be lesser. So anytime the women coughs or having any strenuous activities, their chances of urinary leak will be there. Also vaginal dryness, which causes loss of libido, and painful intercourse can be there. So what are the causes of menopause? Natural menopause is because of the declining ovarian hormones, that is occurs naturally, or some women can attain menopause because of the surgery for some ovarian cyst removal, or because of the chemoradiation for cancer therapy. Also menopause will set in. So what all you have to take care during the menopause? First is prevention of the complications. So how do we prevent the complications which occurs during menopausal age? As I already told you, the complications mainly will be cardiovascular and osteoporosis, that bone weakness, and kind of urinary incontinences. These three things we have to concentrate on. So for cardiovascular health, we have to start with lifestyle modification and exercise as early as possible. Like around at least from 35 years of age, we have to start exercising daily, at least 45 to 60 minutes of daily workout. If possible, some amount of muscle strengthening exercise also will be helpful. Also, from 40 years of age, it is better if you start taking calcium supplements at least 2 to 3 months in a year. In India, most of the women are also vitamin D deficient, so we suggest at least 2 to 3 months of vitamin D intake also in a year. So this will take care of the cardiovascular health and osteoporosis. And the next is urinary incontinence and the vaginal dryness. So these should be treated symptomatically. So if there is vaginal dryness, we give lubricant water-based jellies just during the time of intercourse. If that is not working, we see and evaluate and give estrogen creams so that symptoms reduces. And for urinary incontinence, main thing is the exercise, that is Kegel's exercise, will be helpful in strengthening the perineal muscles. For hot flashes, women should try to stay in a cool environment, wear comfortable clothes, take cool showers daily, and start practicing yoga, meditation and exercises which reduces the impulses, like hot flashes will be reduced. So if the flashes are not reducing with these basic things, we will be starting the medications. There are certain hormonal therapies to reduce hot flashes, and also certain medications, antidepressants. The flushes are too severe that the sleep is depriving, then we start with these medications. So as a whole, women should start exercising, have healthy diet, do not smoke, and be cool and calm, practice meditation and relaxation techniques, and take sufficient supplements, calcium and vitamin D.